We all have good and bad days. Sometimes we feel on top of the world, and other days, if we lose a job, go through a bad breakup, or fall out with a friend, we may be down in the dumps. But have you ever gone to bed one night feeling euphoric and woken up the next morning to find you feel empty and hopeless? Have you ever noticed your high energy levels and racing thoughts suddenly turn to feelings of worthlessness and an inability to experience pleasure doing the same things you once enjoyed? If not, it's unlikely that you have bipolar disorder. If mood swings are campfire, bipolar disorder is a forest out of control. That's the difference. Welcome to my channel BipolarIITian, and today I'll focus primarily on the symptoms of bipolar disorder according to DSM-5. Several important features of bipolar disorder allow us to distinguish between the severe mental condition and the occasional mood swing. The first feature is whether the fluctuations in mood are caused by a situation, person, or event, or appear without cause. While the moods of people with bipolar disorder can be affected by situational variables, people with bipolar disorder also frequently become manic or depressed for no apparent reason. In comparison, for most people, moodiness is tied to a situational event, particularly stressful period, or even hormonal changes in the body. Bipolar disorders are described by the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders (DSM-5) as a group of brain disorders that cause extreme fluctuation in a person's mood, energy, and ability to function. It is a mood disorder that is characterized by alternating periods of depressed and elevated moods. Most people experience normal ups and downs, but people with bipolar disorder, the range of moods is greater than normal and feature extremes. To be considered mania, the elevated, expansive, or irritable mood must last for at least 1 week and be present most of the day, nearly every day. Mania is more severe and impairs day-to-day function and may feature psychosis, leading to diagnosis of schizophrenia. To be considered hypomania, the mood must last at least 4 consecutive days and be present most of the day, almost every day. We will come to this graph later, but first we need to define what depression and mania is. During mania, 3 or more of the following symptoms must be present and represent a significant change from usual behavior. Number 1. Inflated self-esteem or grandiosity, where people feel that they are God or some superhero, leading to the brink of psychosis, or it can be a little less severe, just feeling really high about oneself. Number 2, sleep. That's a big one. Sleep issues. Now, people with mania tend to not need sleep or decreased need for sleep, but totally functioning. You just don't want it and you don't need it. Number 3, increased talkativeness. Number 4, flight of ideas. When you listen to someone in manic episode, their ideas are just flying at you and they are not really making a whole lot of sense. Like you would talk to someone for 5 minutes and you would have heard to like 100 different topics. Number 5, distracted easily. This is somebody that cannot sit still. They cannot pay attention at all. They cannot finish any task at all. Number 6, increase in goal-directed activity or psychomotor agitation. Number 7, impulsivity, that is, engaging in activities that hold the potential for painful consequences. For example, unrestrained buying sprees. And sometimes mania leads to psychosis, which I'll talk about in my later videos in detail. Talking with a doctor or mental health professional is the first step in identifying bipolar disorder. Firstly, a doctor may perform a physical evaluation to rule out any other conditions that may be causing symptoms. It cannot be caused by medical illness or any other psychiatric issue. Mania can be caused by so many different things. Medically, a thyroid issue can do it, traumatic brain injury can do it, temporal lobe seizures can do it, all types of medical issues can do it. Medicines can do it, corticosteroids for example. So you need to rule out all these medicine and medical aspects not causing mania. Make sure that it is not induced by any illicit drugs like cocaine. Give someone cocaine and they will present pretty damn manic. So you have to rule all this out. If no other illnesses are present, the doctor will conduct a comprehensive mental health evaluation to assess the patient's symptoms in accordance with the specific criteria from DSM-5. To be diagnosed with bipolar disorder, a person must have experienced at least one episode of mania or hypomania along with one depressive episode. Mania takes so much out of a person that they tend to crash and go into depressive episode. The depressive side of bipolar disorder is characterized by a major depressive episode resulting in depressed mood or loss of interest or pleasure in life. The DSM-5 states that a person must experience 5 or more of the following symptoms in 2 weeks, most of the day, nearly every day, to be diagnosed with a major depressive episodes. Number 1, anhedonia, that is, loss of interest or pleasure in all or almost all activities. Number 2, sleep disturbance, either insomnia or excessive sleep. Number 3, increase or decrease in appetite. Number 4, psychomotor agitation, that is, engaging in purposeless movements such as pacing the room. Number 5, fatigue or loss of energy. Number 6, feelings of worthlessness or guilt. Number 7, diminished ability to think or concentrate or indecisiveness. And number 8, recurrent thoughts of death, recurrent suicidal ideation without a specific plan, or a suicide attempt. There are two different kinds of bipolar episodes. Bipolar 1, that is where you have manic episodes that are a lot more intense without the need for a depressive episode for getting a diagnosis of bipolar 1. And then there is bipolar 2. It is characterized by extreme highs and extreme lows, just like bipolar 1. But the highs are more like hypomania, which is a less intense form of mania. Then we have cyclothymic disorder, sometimes considered a mild form of bipolar disorder, in which the high energy phase is not as high as hypomania or depressive phase is not as low as major depressive episode. Some people will fluctuate quickly between two extremes with 4 or more episodes of either mania or depression in 1 year, defined as rapid alternating, while some may experience mixed episode where depressive and manic symptoms at the same time. Bipolar disorder has a lifetime prevalence of around 1 to 3%, with males and females being affected equally. It most commonly starts in late adolescence or early adulthood. The exact cause of bipolar disorder is not known, but it is thought there are multiple factors. Genetically, there is a link between family history and an increased risk of bipolar disorder, with studies quoting up to a 10 times risk if a first degree family member is affected. If one parent is affected, the likelihood of developing the disorder is 15 to 30%. However, if both parents are affected, then the percentage increases to 50 to 75%. But this doesn't mean that family history guarantees development of bipolar disorder. Several environmental factors also play a role, like abusive or traumatic childhood. A recent Swedish study reported higher rates of depressive episodes, illness onset at a younger age, and significantly higher rates of psychiatric comorbidity, that is, anxiety disorders, eating disorders, and ADHD among patients with bipolar disorder 2 compared with those with bipolar disorder 1. There is considerable overlap between bipolar disorder 2 and anxiety disorders. ADHD also frequently co-occurs. Approximately 20% of individuals with bipolar disorder 2 also meet criteria for borderline personality disorder, and up to 40% of those with borderline personality disorder are incorrectly diagnosed as having bipolar disorder 1 or bipolar disorder 2. Tables 2 and 3 show estimated co-occurring psychiatric illnesses for patients with bipolar disorder 2. Comment if you also face similar symptoms and how you deal with them. I wanted to also share my personal experiences, but the video has already become quite long, so I will talk about it in my next video. Thank you. That's all for today, and I'll see you in my next video. Bye, take care, and subscribe to my channel for more such educational videos. Please suggest any topic related to mental health on which you would like me to make a video on. Thank you.